We talk a lot about living long, living well, but there is one thing more likely than anything else to take that away from you early, and that's your heart. Heart disease is still the number one cause of death for men, for women, and it's time we start treating it that way proactively, not reactively. So, we are starting this Wednesday series that is dedicated to all things in the heart because you can't achieve longevity if your heart gives out first. So we're going to talk about how to listen to your heart, literally, and give it the care that it deserves. And we're going to be going over a lot of things in this video. I'm going to talk about those things that are kind of outside of what are more commonly known, some things that I think everybody should have some awareness of and options to have a better understanding of what's going on with your heart, because it is, of course, pretty important that we start paying attention to this as the numbers aren't getting any better. We've got heart disease still. This is 2021, of course, the number one reason that people do not achieve longevity, still the top leading causes of death. And of course, we have to do what we can to change that. So one of the things that people don't know enough about, I think, is this omega-3 index. Now, I'm not going to go into this one as detailed today as I normally would, and I will in a future video. But this is one that everybody should know about. In fact, every new client that comes into Strong on Health, this is one of the very first things we do to make sure that we know where you're at. This is going to show you that there's an inverse association with the risk for coronary heart disease mortality. And we want it above 8%. And I'm here to tell you that most people that come in, an average is like around 4 or less that we're seeing. So this is something that's very important to me. Quick and easy answer there is make sure that you're eating good, healthy fish from the ocean 5 days a week. I know that's a mind-blowing amount, or start looking at some good quality fish oils. We'll get into that in more detail another time. Another one is the coronary artery calcium score, or cardiac calcium scoring, which I'll do an entire video about at another time. The next one's very unique and very different. And Dr. Truitt had actually asked me to do this series, so I'm doing this for you, Doc. He had brought in one of his patients to get the heart sound recording done in my office because he wanted to learn more about it. And I've kind of developed my own way to use it over the years. And we had a tremendous result after a very short period of time being able to do this. So let's learn a little bit more about what this heart sound recorder is. First of all, this is from the hsrinfo.com resources, and they say you are what you eat and your heart shows it first. I love that. That's a really important idea that we have to remember. Again, I had my very first client this morning came in, and one of his complaints was that he had some issues with his feet. And I want to remind him that your heart is going to get all the nutrients first. It has to, because that's the way our body needs to keep us alive. It doesn't matter if your toes fall off. It does matter if your heart stops pumping. So when you get in resources into this body, it's going to relegate those resources to where it's most important to keep you alive. That's just another little clue. Keep an eye on your feet. If things start to go wrong with your feet, that's a sign that something isn't getting all the nutrition in your body. I always say I want to get all the nutrition in there, get it all the way down to my toes, because they're the last little guys at the end of the table to get the food. So it's a good sign that you're not getting enough. Another thing that is often said is that we die from the feet up. But let me go back to this HSR and what it actually is. It's an endocardiograph is what it is. And let me just show you the website so you can see for yourself. And this is a computer-based low-risk general wellness monitor, and it uses the principles of oscillation to acquire, display, record, and save heart sounds. And this is a portal where you can learn more about this device. It's a really fascinating thing. And what it's really showing us overall is the rate, rhythm, and tone of the heart. And so I do what I call a 7-point inspection on the heart when I do that. So you can go to this website and learn all about it. It's a really fascinating little tool. There really aren't that many of them out there. I think in the whole world, there's less than 1,000 at this point. So it's pretty rare, and we have a lot of fun with it because we can see how quickly the heart responds to nutrition or other things, chiropractic adjustments, or an emotional change in somebody. It's amazing how much you can watch the heart change in such a short period of time, depending on the input that you're giving to your body. But I'll keep this fairly short because I just want to introduce you to it. In the next few videos, I'll go through my 7-point inspection, but I'll show you what our goal is. Our target here is according to this, there's something called the Paxton chart, and you can get these online. And this is what we want the heart to look like. We really want it to be very clean when it comes to this heart sound recorder. You want a high first sound, a low second sound, and you want this nice and flat in between. I heard somebody say once that if you live to be 100, 67 years of that, your heart's going to be resting. So that would be this time right here. So we're taking a lot of information as to, what you're eating and how it's changing this. And over the years, we've been able to learn a lot of things. So the very first thing that I do look at when I see this is that first sound high? And we do look at 4 different valves when we're looking at that. And if that first sound isn't high, that gives us some information about the strength of the heart and whether it is able to pump all that blood out to get it all the way down to those toes. So over the next few weeks, every Wednesday is going to be another little piece that's going to be adding to this, and also the omega-3 and the coronary artery calcium score. If you have other questions, or if there's anything in particular that you'd like to know more about in this, that's what this channel is for. And Dr. Truitt, I'm going to break them down for you so that you can see them all week after week and give them in small digestible lessons as to how I use this in my personal practice. All right. Have a wonderful day, everybody, and I'll see you in the next video.